Hello, everyone. Welcome to our virtual learning opportunity this afternoon. This is Lynn Brettel, the director of the State Adolescent Health Resource Center. We're so thrilled that you could all join us this afternoon for this virtual learning opportunity. We are really excited to have Dr. Laura Offit with us this afternoon to talk about International Adolescent Health Week in response to your interest around the country in participating in this potential opportunity to promote adolescent health. I just also want to add that this virtual learning opportunity is sponsored today by the State Adolescent Health Resource Center, a resource partner in the National Adolescent and Young Adult Health National Resource Center, and also sponsored by the National Network of State Adolescent Health Coordinators. So with that, welcome, Dr. Laura Offit. Thank you for joining us. I will turn it over to you.
Thank you very much for inviting me to come speak with everyone. This is a passion project of mine, and I'm just excited whenever I learn of other people that share enthusiasm about this call to action along with me. So this presentation is very informal, and so I'm hoping that it's informative and we have plenty of time for question and answer. But what I'm going to do is tell you a little bit about what International Adolescent Health Week is, how it came to be, and then I'm going to walk you through some of the resources we have available for you, and then show you some pictures from past years, because I think oftentimes seeing a picture is a really powerful way to get ideas going about things that are easy to do in your communities. First of all, let me talk about what exactly is International Adolescent Health Week. We have a group of people within the Society of Adolescent Health and Medicine who have formed a special interest group, and this group came together to create a mission statement or a nice definition for the week. And we're calling it an annual international week of dynamic participatory events to inspire adolescents in their communities to advocate for a successful transition into adulthood. And basically, that's very formal language for an annual week, which is a call to action celebrated around the world, where communities can advocate for the health of their young people with fun, interactive events, with anything ranging from social media campaigns all the way to elaborate planned teen health seminars and summits. International Adolescent Health Week is celebrated the third full week in March annually, and this year that is March 15th through 21. And the theme for 2020 is aligned with the meeting theme for the Society of Adolescent Health and Medicine meeting, which is transforming risk into wellness, which I think everyone here can agree is a very broad theme, and it really highlights a lot of what we're all doing when we're working with young people and helping them to advocate for their own health. We have three pillars that are underneath this overarching theme. The first is resilience and mental health. The second is healthy lifestyle, which encompasses things like nutrition and fitness, sexual health, substance use and abuse, preventive health, vaccines. And then holistic well-being, which really incorporates aspects of advocacy, policy, but also an awareness that the health of the earth directly affects the health of our young people. The official color for International Adolescent Health Week is lime green, and this color is chosen because it represents health, happiness, and the high energy and passion of adolescence. So why have a week focused on youth health at all? I suspect I'm preaching to the choir here, but having a week focused specifically on the health of young people is designed to encourage adolescent engagement in their own health. And it's a week to focus young people and adults on adolescent health issues in a positive and proactive way, rather than focusing on fear and negative depictions of adolescence. I think that we all agree that often when we hear sound bites or we see headlines around issues that are focused on adolescent health, all too often the messaging is negative and portrays teens and adolescents in a way that is not accurate and is not really capturing the positive aspects of adolescent traits. Another key component is to teach adolescents health self-advocacy. This is a time in life where we have one foot in childhood and one foot in adulthood. And this is a great week to help pass the reins over to adolescents so that they can learn to take more initiative and take control of their own health to arm them with those skills to move forward into adulthood. It's also a great opportunity to help young people positively influence their peers and families' health. Incorporating young people in planning activities for Adolescent Health Week is a great way for there to be peer leadership and to set good examples in communities. And I think one of the most important reasons to have a week focused on adolescent health is to have an opportunity to dispel common misconceptions. Some of these you can see here on a slide, and one of the biggest ones is adolescent health only encompasses sexual health. And I know that all of us know that that is absolutely not the case. Another is that adolescents often have the misconception that adults do not believe that young people's health issues are important. And I hear that most often around the topics of mental health and stress. But then the flip side is true, that often adults have the misconception that adolescents don't care about being healthy. And we know that that's not true. Adolescents are very interested in trying to want to eat healthy, for instance, or to be physically fit, or to prevent illness. And I do know from talking with Rena and Lynn that internally, this particular misconception is one that has been an issue for some of you that are here on this call today. So what problem is Adolescent Health Week trying to address? One of the biggest problems is that the delivery of health information to adolescents is often ineffective. And this is for a variety of reasons. One of the biggest reasons is that physicians or medics in other communities often communicate too technically. So, I think a good phrase is, we hear young people ask, when a doctor asks me if I'm sexually active, what does that mean? There are some good jokes that can be, cracked in answering that, but I think it's a good illustration of how certain phrases that we use regularly don't necessarily communicate the same thing to a young person. I think often we use technical vocabulary around different behaviors. So a good example is physicians in the medical community using terminology of withdrawal when young people may more often use terminology of pull out. And if we don't meet young people where they are, our messages will not be received and they'll be lost. But physicians in particular are really passionate about using a lot of statistics. And I know from talking with young people that that pretty much will make them glaze over. One statistic might be good, but you get past that and you've lost them. But the lingo is different too. And so a good example here is when teens say they smoke, they may not mean tobacco. And when they're vaping, that's another example. They may not be vaping nicotine, they may be vaping marijuana products. I think we all know that adolescents obtain health information online, but often they're ill-equipped to assess the accuracy of web-based health information. So Adolescent Health Week is a good opportunity to promote educational activities or materials to help young people be critical consumers of medical content that they come across online. Also, young people want to be engaged in their health decision-making. They don't only want to be told what to do. And messages about health often don't focus on what adolescents' concerns or questions are. So although it is important for us to make sure that we're reaching adolescents with health concerns that they may not know that they need to be worried about, it is equally important, if not more so, to make sure that we're actually addressing what adolescents' concerns are. And this week provides an opportunity for that. And then lastly, health education curricula in schools is incredibly uneven. It's incomplete, and it's often influenced by politics rather than science. And this, coupled with a lack of skills in terms of being critical about assessing health information online, can create a lot of misperceptions, which lead to decisions based on inaccurate information. So let me back up for a minute and just talk about, how did International Adolescent Health Week start at all? I love this story because it started with young people. And I love this saying that nothing for young people without young people. I started working in digital health literacy about 7 years ago, and I was trying to solve the problem that physicians and healthcare providers were not online and were not fastly using social media. And I really thought that if we are not online sharing accurate information, our voices are going to be drowned out by a lot of inaccurate medical information. And I think that we would all agree that this is a huge hurdle to try to tackle. So back in 2013, 2014, I decided I was going to start a digital health resource, which I called Real Talk with Dr. Offit. And in order to help me with that work, I would pull together groups of teen advisors each summer as a summer program for them, but then also, most importantly, to help them advise me in my work. And one summer, I came up with the idea of trying to have a teen health week, which I thought originally could be a social media campaign. But one of the young people, and you can actually see him in the top picture, he's the young man in the gray t-shirt, he reached out to me after one of our meetings and he said that he thought we should try to get a state proclamation. And I didn't know anything about a state proclamation or how to pursue that, but long story short, we were successful in getting a state proclamation in Pennsylvania, where we celebrated a Pennsylvania Teen Health Week in 2016 and 2017. In 2018, we decided to try to go global. And the thought process was that since so much communication is digital and is online, that by and large, the internet is without boundaries. It's not totally true because we know that there are certain countries that control online access and digital media in different ways, but we knew that we could have a large reach. So we figured if we have this framework in place, why limit it just to a state? So we decided to expand it to 2018 as a first attempt for a global celebration. And you can see here the different regions around the world that participated in some ways. And I understand from other conversations that a number of you were involved in Global Teen Health Week in 2018 as well. So here we are in 2020. International Adolescent Health Week is a continued evolution of Teen Health Week. We've expanded the target age group to be in line with the international definition of adolescents, which is ranging from ages of 10 to 21 or 24. And we are approaching the week in terms of younger adolescents, which we may call tweens, middle adolescents, and then older adolescents or young adults. So the age scope that is the intended audience for this initiative is broader. And again, we are doing this on an international scope, working closely with the International Association of Adolescent Health and the Society for Adolescent Health and Medicine. So this right now is what our map looks like. We are almost to the date, a month in advance of International Adolescent Health Week. So I know that this map will get a lot more densely populated with dots as we get closer and closer. So one of the questions I've gotten a lot is why lime green? Well, lime green was really a deliberate choice as a color to represent the week. The first reason is that it kind of sits in between baby or pastel green and then what I like to call more mature or dark green. And it's right in the middle there. And I think that's a nice visual in terms of adolescence. It's also a gender neutral color. It's not pink or red. It's not blue. So it doesn't represent a single gender. But it does represent health, high energy, happiness, freshness, progress, and vitality. And it's really important to have an official color that promotes a visible recognition of the importance of adolescent health. What you can see here on the bottom, there are 3 logos from this year. These are all designed by youth. There's one from each age group. And then you can see some pictures from previous years of some of the materials that were used in Teen Health Week in the lime green color. So we have a number of resources that are available, and I am going to walk you through these a little bit, but just so you can make a note, we have a website where everything International Adolescent Health Week related is uploaded. It's internationaladolescenthealthweek.org, so it's easy to remember. On this website, we have physician-authored medically accurate toolkits. We have the youth-designed logos that I mentioned. There's a fun story here. in order to get the logos for this year, we decided to run a youth logo contest, which was something that I had been wanting to do for a couple years. And we had 3 categories where young people could enter to be between the ages of 10 and 14, 14 and 18, and 18 and 24. And then we had a group of volunteers from the Society of Adolescent Health and Medicine that agreed to judge the logo contest, and we selected 1 logo from each age group, and then had an official main logo as the grand prize winner. And the grand prize winner actually is a young gentleman who is 14 years old from Morocco. So I think that the logo contest is a really fun way to demonstrate youth involvement in this initiative. We also have sample social media posts, ideas for free and inexpensive events. And this year we have dedicated International Adolescent Health Week social media. So you can see that we are on Twitter, Instagram, and Facebook. You can go ahead and follow us for updates and for ideas. I do want to do a shout out to a local med student who is doing her master's in public health, and she is doing a social media project with International Adolescent Health Week as her capstone project, and she is running the social media for us, which is a huge help. And it is also a fun opportunity for her to learn and experiment with social media as a tool to reach adolescents with health information, which is her area of study. So the next series of slides is me walking you through the resources. This is a screenshot of the home page of the website. There's a countdown here. This slide deck is was put together a little while ago. We're actually 31 days away from International Adolescent Health Week, and you can see on the bottom left there is the menu of where to access the different components. There's actually a footer that I didn't grab in this screenshot that is a rotating slideshow with pictures of events and people all around the world that have celebrated in the past, and it's kind of fun to look at. This is the resources page from the website, and on this resource page is where you are able to download different toolkits. We have a planning toolkit, which is a toolkit that helps you plan, a month in advance, a week in advance, that sort of thing. Things to think about to make it easy to jump right in. But then we have a specific toolkit for each of the 3 pillars that are underneath the Adolescent Health Week themes. Also on this resources page, you can download the logos. The official logo is the logo that's on the right with the kind of stick figure on the black background. The other 2 logos are the winners from the different age groups, but you are free to use any of these logos, and we also have other formats available if you need them with a clear background or so on and so forth. There's direct links to the social media as well here, and then as we are getting additional resources that are not in the toolkits, we are uploading those as well. So you are free to use any or all of these materials. And what I'm going to do is show you a little bit more of what is in the toolkits, because I recognize that it seems like a great idea to download a toolkit, but who has the time to go digging through a bunch of stuff? So let me just show you what's in there so you can find easily what you're looking for. Like I said, there are 4 toolkits here. One is a general planning toolkit, and then there's 3 for each of the different pillars. Within each toolkit, there's a little bit of background information, but the structure is a repeat of this basic framework where you can see in a medical practice, there's some suggested activities or ideas. Then again, for activities that could be done on a school-wide level, there are some ideas, things that can be done within the setting of a health class, and then there's sample social media posts for Twitter and for Facebook, as well as ideas to use social media in order to promote the week. So the idea here is not that you're mandated to use any of these specific ideas, but often it's either easier to grab something that is already thought of for you, or reading through some of these ideas, you might spark another idea that is better for your youth that you're trying to reach. But again, you are welcome to use any or all of these ideas. You don't need permission for them. They're just available as a free resource for all of you. This is a contact page that is on the website. I did show you a little screenshot of our global map as it stands now. If anybody wants to get added to the map or they find their way to the website, we're asking just for an organization name and a city and a country here so that we can reflect participation accurately. I will say that one of the things that I do hear from young people that they find really powerful is to look at this map and then see that all over the world, people really care about their health. It's just a really powerful visual, and I think it's inspirational for us all working together in this, what really is a small world, but also for young people to realize that they are valued and loved, and a lot of people care about them. These are screenshots of the different social media. So again, we're on Twitter, Facebook, and Instagram. Our med student was not able to make the name exactly the same, but as I mentioned, the links are right on the website, so you can click on them and follow that way. Or the Twitter is at IAHW 2020. The Instagram is at adolescent_health_week. And then Facebook is at International Adolescent Health Week. So we do encourage you to follow there. And at a bare minimum, one of the simplest things to do is to follow the social media and then to reshare the posts that are there. Sarah is putting out different ideas and different things to encourage participation and to get expanded interest in the week. But that is the easiest thing to do. That is minimal work on your part. One of the things that I emphasized is that it's critical and important and really inspirational to have young people engaged in and involved in the planning and execution of events. And so these are, again, just some pictures from the past. We had a ceremony in Pennsylvania when we celebrated Pennsylvania Teen Health Week, where we had a formal presentation of the proclamation by Dr. Rachel Levine, who's our physician general here. And we had students get nominated by their schools as young people that should be recognized for promoting health in their schools. And these young people were invited to read different components of the proclamation in a formal ceremony. We also had a yoga and meditation event. I guess it was in 2018 now. And again, in this activity, young people were responsible in a volunteer capacity for helping to facilitate and organize the event and to encourage participants with their peers. Digital posters is another easy and inexpensive way to be a part of Adolescent Health Week. These are some examples from the past where organizations that had a specific mission took advantage of the week to be able to promote information and advocacy around that specific mission. I think oftentimes what works best, since there's such a breadth of different health topics that need to be addressed, is to pick one that is of critical importance in the young people in your community right now and spend the week to focus on that. Here's some pictures from different educational events in Nigeria. This will be the third year that Nigeria has hosted a teen and adolescent health summit. One year I had the pleasure of being able to watch their live stream. They did Facebook Live, and it was just so exciting to be a part of this event around the world celebrating adolescent health, while I knew I was sitting here outside of Philadelphia celebrating in our own way. You can see that one of the universities, I believe this was in Portugal, in the upper left, had a session in a lecture hall. And then the middle picture is in Philadelphia, where one of the local universities partnered with a high school to run a health-related event during Teen Health Week. The yoga meditation event that I mentioned, you can see picture the lower right. I know that there were some community libraries that decided what they would do is they would have a display with youth-focused books, in particular things that address health issues in young people and adolescents, and they decided to celebrate Adolescent Health Week that way. Literally a free thing to do just to celebrate the week. In Indonesia, one of the topics they wanted to really tackle was traffic fatalities, because that's a huge problem in their community. And so they had a march, you can see pictures here, to their government building to help tackle that problem. And you can also see a group of younger adolescents in a different event in Africa from 2018. Medical practices, obviously, this is a obvious place for celebration of Adolescent Health Week. And so what different practices have done is, wear the lime green, they have shared different sorts of health information or giveaways in the practice. One practice has kind of a trivia wheel where when people come in or are waiting in the waiting room, they can play a trivia game and win a prize. And all of the trivia is around health-related facts. Larger medical organizations do different things as well. In 2018, the American Medical Association shared a lot of material around Teen Health Week, promoting a national awareness. The National Health System in the UK was involved, and they are involved again. And they had used the week to pilot certain initiatives that they were interested in test driving to promote a specific area in adolescent health. And they thought the week was a good opportunity to kick that off. As I had mentioned, the whole thing got started with the idea of having a proclamation. And this is another simple thing that can be done, is to request a proclamation either at the township level or the state level, or some sort of regional government body. I do think that a lot of times a local and regional government like to celebrate young people. And so I live in Delaware County in Pennsylvania. And so the Delaware County Board of Commissioners wanted young people to come and be honored as part of a formal presentation of a resolution during their meeting time that occurred during Teen and Adolescent Health Week. Some community partners are willing to donate either healthy snacks or donate other things to help support community-based events. Putting some signage or just an announcement on school bulletin boards or digital billboards you can see here. That's very easy to do, and it's free. And you would be surprised at how easy it is when you have buildings in your community that do any sort of event lighting. They're incredibly receptive at promoting community events. And so here in Philadelphia, we've had a lot of success getting a number of the buildings illuminated lime green. I will say that this is another item that young people really love, to walk out of an event and to look up and see your skyline in your city illuminated lime green, and knowing that that's because of you. That's a very powerful visual. And we'll be doing that again this year here. It's a great opportunity to engage media. A lot of times local newspapers or radio shows are interested in covering a specific adolescent health issue, and to have a lot of press attention around adolescent health issues over the course of the week, again, is a very powerful way to increase the visibility of adolescent health needs, which obviously have gaps in terms of being addressed in our country. And here's a couple ideas of just inexpensive giveaways. Everybody loves tchotchkes. We had some M&Ms made up with Teen Health Week a couple years ago, and I always say that yes, there is room for chocolate in a healthy diet. So just because we're celebrating a health event, that doesn't mean you cannot have candy. But obviously, Granny Smith apples are perfect. They're the proper color, and they're a healthy and delicious snack. And one of the practices in Austin was giving away toothbrushes in the past for the week. And here's some pictures just of some school-based activities. One activity that has been done a couple years in a row is A university has come into a local high school, and they had some local sponsorship and funding where just inexpensive lime green shirts were brought in, and the students were charged with decorating their shirts with some sort of health promoting message. And this activity is a big hit, and I believe is being done again this year in a local school. So I was going to pause here because I know that some of you had done things in the past, and oftentimes sharing ideas amongst ourselves is just a helpful way for others to get started. So I will pause here if anybody has anything that they want to share.
And we will begin unmuting everyone for the Q&A section. But if you would like to share an example now, you can raise your hand to be unmuted or type it in the chat box.
I saw that Tiffany from Florida raised her hand. Do you want to share, Tiffany, what you've done?
And if people feel funny about sharing, that's fine. Like, I'm happy to continue on, and then we can get to the Q&A. I just don't want to just barrel through without giving other people opportunity to talk.
Tiffany, I think you are muted on your end. If you can see if you can click your microphone. Okay, looks like we may have some audio difficulties for Tiffany. So Laura, you can go ahead and proceed.
Sure. And then as we have everybody unmuted with the Q&A, we can have this discussion there as well. So it's very easy to get started. And actually, this call today is, I would consider, an official start. Like I had mentioned before, I really would love to add as many interested organizations to our map as possible. And I was even thinking, looking through the attendance list, it's really nice to see some familiar names and really exciting to see a lot of new names. So I may, if it is okay, just go ahead and add the different organizations that I see here. But if somebody does not want to have your organization added, please just let me know. But I'm including everyone in this map, with no matter how small an effort is made, because I do think there is something really powerful about a lot of people doing a small action, because all of our voices collectively together can really create positive change. So now I am available for any questions or discussion. Anything that you need some clarification on, I'm all yours.
So there's a question in the chat box about, is there a way to find out what people around us are doing? And I'll let you answer that, Laura. I'm assuming that people can click on the maps that you've been showing to see what the media around them.
So what is on, ooh, there's quite an echo. I don't know if that's me. Is it okay?
Now it's better, yeah.
Okay. So what's on the map are different things. Sometimes I just learn that organizations are planning to be involved, and so then the name of the organization and the location is there. If someone tells me about a specific event that they would like me to load into the map, I can do that as well. Right now, we don't have specific events in there because most people just have shared either city and country or the name of their organization. But the map is on the website, and you can zoom into it. So you can look in your local area and see if there's any organization near you that's participating. I do know, I don't know everybody that's participating, because it's a step of people either letting me know their colleagues or individuals that come to the website taking the time to fill out the form. So sometimes we end up finding out about things on social media or just through the grapevine. but we're trying to make the map as comprehensive as possible.
This is Tanya from Utah. Can you hear me?
Yes.
Yeah, I'm the one who sent that question because I saw the map and it says that's up at the University of Utah, and I work for the state. And I clicked on it and it just said like School of Nursing. So I was like, oh, who in the entire School of Nursing is doing something? And it would be nice to find out so we can coordinate things if possible. That's why.
Awesome. Thank you for clarifying, Tanya.
Mm-hmm.
I'm going to write that down and see if I can retrace the steps. It may be somebody that is in the Society of Adolescent Health and Medicine Special Interest Group, or it may be somebody that just entered the information into the box on the website.
So for the benefit of those of you that might not be on a computer, and I'm not sure if people are seeing the chat on the side of the screen, but Tiffany from Florida, who doesn't have microphone capability on her computer, said that in 2018, she hosted a week of inter-office Jeopardy, which is a fabulous idea, to engage partner programs with the entire Bureau participating in the final Jeopardy activity with awards and lime green snacks. And it was a great way to educate colleagues about adolescent health. I think when Tiffany had talked about this before, she shared that this was a way to tackle some of the misconceptions that you addressed at the beginning, Laura, that sometimes people think adolescent health is simply about sexual and reproductive health, which is of course a lot of the work that we do, but definitely not all encompassing. So thank you for sharing that idea, Tiffany.
Yeah, I do think that that is one of the major hurdles, that I think we all have. And being able to just debunk that misconception, especially on an advocacy level, I think is very powerful.
So I also have a comment from Julie, who wasn't able to participate via computer as well, Julie Neitzel-Carr, who is the president of the National Network of Adolescent Health Coordinators and Minnesota's State Adolescent Health Coordinator. And she just wanted me to convey how exciting and inspiring this whole campaign is, and that it's really well laid out and well thought out, which I definitely agree. It's so purposeful. I love the explanation of why you picked lime green and the reasoning behind that. And I was sitting here myself getting choked up at the thought of thinking about those young people reading parts of the proclamation and seeing photos from young people all around the world. It's really a cool thing to be a part of. So I just wanted to convey those thoughts from Julie and then editorialized myself at the end.
Thank you. I will add too that I think sometimes, when I deliver all of this information at once, people leave and then, they have a follow-up question or need some additional support. So I am available to help support you in any way that I can. So if after this discussion you leave and you have a question, or you want me to try to retrace my steps and see if I can figure out who in your region has already expressed interest in doing something, I can try to do that to the best of my ability. So please don't hesitate to reach out to me so that I can help you.
Any other questions or comments?
This is Hello, this is Rena from the State Adolescent Health Resource Center. I have some serious I type a question in the chat box.
I think Rena is trying to share something with us and having some major feedback or what do you call it? Reverberation. So Rena typed her question in the chat box, what she was trying to share verbally. Is anyone doing proclamations around other health observances?
This is Laura. Just to answer from my perspective, not that I am aware of specifically for this, but I see somebody said yes in the chat box. I'm going to mute myself because I think that I may be contributing to the reverb.
This is Julie in Minnesota, and in the past we've done proclamations in May for Teen Pregnancy Prevention Month, but that's kind of had a whole switch up, and I like moving over to Teen Health Month or Week because it's just more all-encompassing, and so this might be a switch that we'll do in the department.
One of the ideas I really loved, Laura, was the encouragement to contact media. I think sometimes we wait usually to be contacted by media. And I know that many of us have restrictions being part of, state government and adolescent health departments that, speaking with media can be dicey. But I know that in the past, when I've had contact with radio stations, particularly public radio, they're often looking for ways for things to create a show about. They latch on to things like health observances, so I think I love the idea of reaching out to them and letting them know about International Adolescent Health Week and offering yourself up as a resource. That's a great proactive way to kind of get ahead of the message as opposed to waiting for news about adolescent health to come out and then asking to react to it.
Right. I think that's a good point. And then the other thing too is that often smaller publications, community-based newspapers and things like that are really looking for stuff to put in there, but they don't have journalists to put it together. So for people that like writing, they're very receptive for accepting pieces to be published. Just from an informational standpoint, or, if you say you want to highlight an issue around, vaping or Juuls or something, and then have it published that week, that can be very powerful too.
Tanya, would you like to share your thought?
Well, yeah, when you guys were talking about the media, here the Utah Department of Health has a partnership with one of the television stations.
Oh, cool.
And we do a segment called Check Your Health. And they talk about everything, screenings and nutrition and all that stuff. So I got myself a spot at the beginning of the month to talk about International Health Week for the adolescents, because it's going to be it's going to be a new thing.
That's awesome. So that's on
March.
On local public television?
Yeah.
Great.
And here Utah it's small. It's one of the smaller states over here in the West. So we have one media out, like not one media market, not outlet, but one media market. So it actually reaches the entire state, and it reaches even parts of Nevada and Wyoming.
That's great.
So yeah.
That's great.
So if you can do some type of partnership or work through what some programs do here in the health department is they have partnerships with other organizations in the community, and they are the ones who go and do the television spots and interviews if the person in the health department doesn't want to do it. We just give them information and prep them and stuff.
Okay.
That's another option.
We would love to, like Rena is saying in the chat, and Julie, that we would love to put everybody's examples on to share them, make sure that you let Laura know so we can, your events can be added to her map, but also we would love to make sure that we can share information widely with the network about everything that you're all doing. These are great ideas, very exciting.
And one way that we can help, if anyone is interested, is if you are sharing or promoting any of your events or your press or your, television features or anything like that through your social media, the hashtag is IAHW 2020, and we're searching that to see what we can find so that we can go and share that back out again. So if you end up putting the hashtag on any social media posts, we do go looking for those so that we can amplify your message as well.
Cool. We have about 10 minutes left. I'm wondering if anybody else has other questions or comments or things that you'd like to add.
Hey, Lynn, this is
Yeah.
Rita.
Hi. Rena's calling from her spaceship today. So if there's no other questions, we can close up. I don't know if Rena is perhaps typing something in the chat box. So if there's no other questions or comments, I just want to again say thank you to Dr. Laura Offit for joining us and for hosting this, being willing to participate in this all call. It's really exciting to hear all the ideas that that International Adolescent Health Week provides. I think it's, like I said before, just a really accessible initiative and so inspirational. So for those of you who are on the call and participate and do anything, make sure to get on the map and let us know, follow up with us on the listserv so we can share resources and share all the fun, exciting things that everyone is doing. I mentioned at the beginning that the website will be archived, so if anybody wants to share it and share the resources, you can find it on the National Network's website. It will be archived there. Also, a reminder that coming up next month, we will start the first in a series of 3 webinars focused on young adult health. And so that webinar will be March 11th, I believe at 1 o'clock Eastern time. And so I'll put out the registration for that either later today or tomorrow, so you can sign up. And again, that's March 11th. And I believe that's it for now. There's lots of information about other adolescent health observances on the website as well. So this final slide that you're seeing reminds everybody about the resources that are available on the network's website. So be in touch with your exciting initiatives, and thanks so much for everyone in making the time to join us today.